Good morning and welcome to Senator Tom Brewer, legislative candidate from District 43. Thank you, Senator, for joining us for our virtual legislative candidate meetings. My name is Gina Ragland with AARP Nebraska, and joining me today is Susan DeCamp, Bob Lassen, and Danny DeLong, all AARP lead advocacy volunteers. AARP State President Dave Holmquist is also joining us, as well as Emily Wick from our state office. Senator Brewer, we appreciate your taking the time to meet and discuss issues of importance to our 50-plus voters and their families across Nebraska. As a reminder, this meeting is being recorded and will be shared with AARP members across your district prior to the election. So, Senator, if you want to start us off by giving us a little background about yourself and your campaign. Again, we're aiming for 5 minutes or less on that. And once we've completed that, we'll go into the questions. So, again, thank you for joining us, Senator.
Well, thanks for having me. Again, I apologize for being on the road, but unfortunately this time of the year, it's kind of your primary residence, I guess, because it just seems like there's always something to do, especially when it's 460 miles from Lincoln to your home, and your district is 13 counties, which includes Cherry. So a lot of ground to cover there. Anyway, grew up in Gordon, Nebraska. Went to Doane College, did track and field there, and then received my commission through ROTC at Doane, and went on to be an infantry officer in the Army. Did that for about 6 years, and then was asked to transition to fly Cobra helicopters. Did that for a number of years, and then was selected to be on the U.S. Olympic team, U.S. Olympic shooting team. And so that kind of opened up some avenues to end up being the commander for the Army Marksmanship Center. And then from there, it was about, let's see, what do we do? 6 tours of Afghanistan and 2 of Kyrgyzstan. And tucked in there was 2 years at Offutt aboard the National Airborne Command Center, which is the 747 that you see landing here in Lincoln. Sometimes it looks like Air Force One. That plane is a aircraft that's in direct support of the president and the Secretary of Defense. So upon being wounded in 2012, was sent back to Nebraska to rehab at Madonna, and spent almost 2 years going through surgeries and rehab at Madonna. Finished that, went to Montana to work with wounded veterans for almost 2 years. And then was asked to consider running for the 43rd district. Made the decision to do it, and I guess the rest is history. Was elected. My first 2 years served on the banking and insurance because evidently I knew the least amount about that, so they wanted me to do that task. But also was the vice chair of government for the first 2 years. That was a pretty good fit because it's government, military, and veterans affairs. So that was just kind of a natural fit there. 2 years in, was elected the chairman of the government committee, and then was also moved from banking over to education, which was a very good move. It's something I felt more comfortable with. It applied to the district more. So it was just a fit that once you kind of got your arms wrapped around everything they do, was a very enjoyable change from banking. And with that, I guess most of you guys have probably tracked kind of what's going on in the legislature. We've been fighting for a long time to get property tax relief, and we were able to do that. Obviously not what we wanted, but the need to have the economic development piece of that, the need to help the university with the new facility there, really made LB 1107 a necessary bill. And looking back on it, I was glad we were able to push it through, because we did have that break for the COVID-19, reset. And so that was kind of hard to come back and have those last 17 days. We talked a little earlier. Unfortunately, my district, or fortunately, however you want to look at it, it's hard to go door to door because it's so spread out. Those 13 counties are all very rural. So the decision was made, as we had done 4 years ago, to do the ride across the district, because you're in a little town every night somewhere. And that's a good way to get out and meet folks. It's not necessarily the easiest way, but I think we're in a good position coming into the campaign, and we're hoping that it'll all work out.
Perfect. Thank you, Senator. And most importantly, before we proceed, thank you very much for serving our country, our state, and for all that you do as a veteran. We do appreciate that very much. Again, we provided you with a set of 3 questions pertaining to the 50 plus in Nebraska, allotting 5 minutes for each of those questions. And so to lead off, our first question today will come from our state president, Dave Holmquist, addressing helping people stay in their homes and communities. So go ahead, Dave.
Good morning, Senator. Thanks so much for joining us today. I know your schedule is very busy. This question about helping people stay in their homes and communities has to do with livable communities. So a livable community is one that is safe and secure, has housing that is affordable. In other words, no more than 30% of income is spent on housing, has transportation options that allow individuals to travel by multiple means, and has supportive community features and services for people of all ages, which allows people to remain in their communities as they age. What steps would you take to ensure all Nebraskans have access to livable communities?
Well, and mine might be a little more targeted toward the district because, it's kind of the nature of their situation out there in the small towns. We are struggling. And just to give an example, the towns that I visited along the ride all have lost population in the last 4 years, and let alone the last, if we were to go clear back to, to when I was in high school, a very long time ago. Most of those towns are almost half the population they used to be. Most of them have lost population since the last ride. And it's kind of heart-wrenching because even though I understand it's businesses that you see that are closing in the downtowns, it has a ripple effect because Gordon used to have 2 pharmacies and now they have a part-time pharmacy. And Gordon's a town of 1,800. It's relatively big for that part of Nebraska. As you reduce availability of resources, it affects everything because the elderly are challenged to get what they need. And on the housing side, we have a continued cost of living increase that doesn't correlate to what they receive in Social Security benefits. The other thing you realize from talking to the population is a lot of them, saw Social Security as kind of an umbrella of protection, and as they get there and realize that it really wasn't designed to be a sole source of income. But if that's all you have, now you've kind of put yourself in a position where, as property tax increase, as availability of whatever resources you need, food or medical medicine, your quality of life goes downhill because there's less and less available. So obviously, if they still own their home, property tax is huge because the more we increase, the more it takes away. If we don't do something to stimulate the economies in these smaller towns, they're going to have less resources. So then it's traveling to, from a Gordon to a Shadron or to a Scotts Bluff to get what they need. And that's all woven in with even our small town hospitals or clinics, because at some point they have to be able to have a profitability. And right now, COVID has put many of them in a bad position because we stood down so much of what was really necessary in the way of medical care because of the concerns about COVID-19. And so now we're trying to help those hospitals stay alive. And I guess the picture I'm trying to paint for you is that all of this is woven together in our current situation where we have less and less of resources or available resources to seniors to live on because of the requirements that they can't control. So back in again to LB 1107, the idea was to give substantial property tax relief. It was not. It was helpful to the tune of about 3 or 4% the first year, and then it'll go to about 8%, and eventually we'll be in that 12 range, depending on the economy, because it is dependent on some growth. But that has to be one of the things we keep in mind, because a lot of the seniors still own their own homes, and we're putting an undue burden on them as we increase property tax, and they receive nothing for it. And they're not going to receive any increases to compensate. And at some point, it's a straw that broke the camel's back, and they don't have what they need just to exist. I think in addition to that, we need to be careful about, well, again, I'm going to go back to Gordon because my mom's in the senior home there, and the senior home and the hospital are actually woven together there. So if one fails, they both fail. So it's essential that we make sure that those facilities are kept open and available. And I think at some point the state has to figure out a better system of compensating those facilities for the care, because we have put in so many layers of paperwork that it makes it a burden that they cannot fulfill sometimes, and then they're not compensated like they should, and then they go into this death spiral where they cannot recover from that financially. So I think whoever's the new Health and Human Services chairman is going to have that really high on their list, and I've already indicated that's something I'm going to try and watch from the chair of the government side of this. But those are kind of the things that are impacting and affecting our ability to keep them in their homes, but also to have a facility available for them at the point in life that they need that day-to-day care.
Right.
Thank you.
Perfect, Senator. Our next question now will come from Susan DeCamp, and it addresses health, caregiving, and home and community-based care.
Good morning, Senator. It's nice to have you with us. And I would just like to echo Gina's comment in thanking you for your excellent service to our country. My question: caregivers help older persons live independently at home by providing assistance with activities like bathing, dressing, and performing medical and nursing tasks, such as administering medication and wound care. The caregivers often provide these services with little or no training and little or no pay. So with that in mind, I have a two-part question for you. First, would you support helping caregivers with things such as paid leave, respite services, telehealth, and access to education and training? And secondly, how would you protect or expand paid services and supports, as well as financial security that allows more seniors to live independently in their homes and communities?
All right, well, both good questions. Hard questions, but they're still good. Let's start with the first one. The caregiver piece of this, and I guess it's inevitable that as time goes on, you're gonna become not only more aware of it, but you're gonna become personally involved with it. My mom is in the home in Gordon. My father is in it's assisted living in Rushville. And it just kind of worked out that way because of available beds, and Dad's able to help himself and do some things where Mom's in a wheelchair and somewhat limited. My sister's a nurse, an RN, and my niece is a nurse practitioner there in Gordon also, and then my daughter-in-law is a OT. And so I get a lot of feedback from the three of them about the issues and some of the failures, and that's I don't want to say necessarily beauty, because sometimes it's a pain at the family outings when you're getting machine gun on why things are the way they are and why you haven't got them fixed already. But there is not a level of compensation there should be for the care that they're giving. And my sister, niece, and daughter-in-law all are more at a little higher level. But the problem is, when there's nobody below, it don't matter what position or I guess in the military we call it a rank that you have, you still got to do it, and it doesn't matter. It still needs done, and they express their frustration that because there's a lack of compensation, they can't get the folks they need. So those people with higher qualifications end up having to do some of the basic tasks, and that leaves them unavailable to help others at the level they should be. So in answer to your first question, I fully support that. We are using telemedicine more. I've been working with the White Clay community. That's kind of been one of my taskers that I've taken on, is trying to help White Clay. If you're not familiar with White Clay, they have a beautiful senior home there that is able to handle, I want to say 66 beds, but it's new, it's beautiful, it's well maintained. Their challenge, of course, is staffing. And we have been able, through Indian Health Services, to help there. We don't have that luxury in other places. There it has to be compensated through the payments that people make for where they're living. If that's not available because of, say, Medicaid, then it's on the burden of the legislators to make sure that that compensation is adequate. And part of that, I think, is getting the message out to the senators about what the ground truth is, what is the situation, what is needed, and I think that's somewhere where we can do better in the future. I think if we tell them, or maybe even figure out a time when we can have them visit some of these places, they would then be more willing to say, it is needed and we got to figure it out. Again, that's going to come through Health and Human Services Committee. So I don't know who's going to chair that next year, but they need to probably be that conduit, that voice that helps the rest of the body in the legislature understand what needs to be done. And so hopefully that happens. But question one, fully support it. And I think telehealth is going to be a wave of the future, because we're just in a situation, at least in my district of counties, that it's so remote that without telemedicine, it's an unfair burden on the seniors to travel as far as they have to travel. And let's see, real quick, the second question.
Expand paid services and supports, or protect them, and then financial security.
Well, I guess I kind of weave some of that in the first question too,
Right.
but we just got to figure out how we tailor the legislation that comes out so that the resources we're providing can be utilized. We put enough layers in, and I'm working issues with first responders right now. And a few years ago, they passed a bill that was going to give a tax break to firefighters, and it was a great idea. But what they added with that was so much paperwork. The firefighters are like, it just isn't worth it. I don't need the $250. I'll just get by without it. Well, shame on us if we do that, because now you've made it so that people don't use that, that option, and they consequently aren't able to, have something to compensate for the time and effort and everything they put in. When it comes to senior care, that's not something that's a volunteer thing. That's something that we have to have, because they're going to need help in some cases 24/7. And at the point we don't have enough of those, then we put the whole system in crisis. So, that's the one place we really can't fail. Yet I think we're on the brink of it. The COVID-19 has caused a lot of issues with staffing that we hadn't thought of before. And so I think that whole look at how we handle things need to be reset for next year. I think we gotta just clear the whiteboard and see if there isn't a better way of caring for our seniors, so that COVID or not, we're there with the right people at the right time.
Great. Thank you very much for that thorough answer.
Thank you, Senator. And our third question, we've really already been in this space. And so I think it might be, we'll have Bob ask the question, and certainly if you have any additional thoughts on it. But again, Bob Lassen will address nursing facility quality. So go ahead, Bob.
Well, thank you, Senator, first of all, for your service. And also, you might pass along for all the members of the healthcare industry that you'd mentioned. We thank them for their service also. My question deals with the nursing facility quality and the factors that affect that. There's an estimated 6,600 Nebraskans that currently reside in one of Nebraska's 211 nursing facilities. By 2040, the University of Nebraska Omaha projects that number will more than double to almost 14,000. Due to a variety of factors over the past years, Nebraska has seen an increase in nursing facilities having to close and residents having to relocate elsewhere. Now, specifically, my question, you've answered a lot of it when we talked about adequate nursing resource and proper reimbursement. But I think I'd like to add to that recruiting nursing workforce for these more rural facilities to help with their workforce. So do you have any ideas on how we could recruit and nurses to go back to these facilities?
Well, again, I'm using some of the ideas that I'm getting from nurses, my sister and my niece, and they said, that in the initial education that they receive as a LPN or even as an RN, it's not really tailored for seniors. And the comment they made was, why don't we have a block of instruction or a branch of that particular degree program that is focused on seniors, so that particular needs or the unique problems that you have with seniors, they're given an experience and a hands-on before they go out into the real world. And then, their idea was that we need to have a long-term program so that they can see the light at the end of the tunnel and say, if I serve in this capacity for X amount of time, I will have a retirement, and that this is a life tasker that I'm having, rather than people kind of do it as their time and location are available. And so I thought about that for a while. Where else do we not give specific training on a particular need? And so that's I guess my thoughts there is, let's see if we can't tailor our care for our seniors so that it is, it's more of a purpose ending when you go through your initial training, and then folks will not only have the experience but then have the focus on the end, and that being something that will be a life pursuit rather than a passing behavior or working with someone.
I think that's a great point, Senator Brewer. Again, it's that investing in our future. So finding kids at young ages in our communities, if we can train them in the community, they're more likely to stay. So we very much appreciate your thoughts on that. We are coming to the end of the time. So I'd like to offer you the final minutes for any closing thoughts or comments that you have in the final minute, or any messages you would like to send to your constituents. So the floor is back to you.
Well, thanks for the time. And I know you guys are busy too. We have an obligation to the folks that have been there for us. Many of the people that I see in the retirement homes with my parents, they're the ones that were the store owners and the manager of the city, and they're the people that made things happen. Well, now they're at the point in life where they need help, and they need to know that those final years are going to be quality of life and not a challenge every day just to survive. And so that's the burden we have, and shame on us if we don't figure out a way to make sure that happens.
Perfect. Thank you, Senator. Thank you for visiting with us and taking the time. I know you are busy. I know you're traveling lots of miles, whether it be in car or on animal. So we do appreciate it. We wish you the best with your campaign. We look forward to working with you in the future. And most importantly, thank you for meeting with AARP Nebraska today.
Well, thank you, and thank you for what you guys do.
Thank you, Senator.
Thank you.
Have a good day.
You too.